Warning, censorship. Warning, censorship.
Since publishing my report on Pinecrest Nursing Home in Bobcaygeon, Ontario, the outpour of tips and groups that have reached out to me, it's been overwhelming. I knew the state of long-term care across Ontario and in other provinces needed help, but I certainly didn't realize how tragic and deep-seated the issues run. For Rebel News, I'm Tamara Ugolini, and I'd like to do what I thought would be a quick update on the atrocities faced by seniors in long-term care. There is so much news coming out every day that it seems like we almost become immune to the severity of some of the stories that we hear. What's happening in long-term care is appalling, and my investigation is confirming what other advocacy groups like the Guardian Angels for Seniors program, the Concerned Friends of Ontario Care Facilities, among many other individuals with family members in these homes have been saying, that there are decades-old systemic failures happening to our elderly. Now, I realize that there are great people out in long-term care, both working and living in awful conditions in a system that is repeatedly described simply as broken. The military report confirmed all of this. It outlines negligence and depravity, from cockroach and bug infestations, seniors screaming out for help, rotting food, infected patients put in the same room as those who are healthy, missed meals, seniors left in soiled diapers, and so much more. It certainly didn't list Pinecrest Nursing Home specifically, of which nearly half of their residents died in a mere 2.5 weeks to what appears to be the hysteria generated by COVID-19. And that was during the first wave in the spring of 2020. See, it's odd because the Ontario Science Table, that's who provides pandemic response guidance to the Ford government, they published this science brief in January of 2021 titled COVID-19 and Ontario's Long-Term Care Homes. The brief starts off by confirming what we all know, that, quote, Ontario's long-term care home residents have experienced disproportionately high morbidity and mortality, both from COVID-19 and from the conditions associated with the pandemic. And if we fast track to page 4, in the super small fine print, that number is an astonishing 81%. See that graph? It highlights Canada as having the highest proportion of COVID-19 deaths in long-term care among the 16 other countries within the Organization for Economic Cooperation and Development. Again, I reiterate that during the first wave of COVID-19 in the spring of 2020, 81% of deaths were in long-term care homes. That's huge, especially if residents were dying of neglect and not COVID-19. In that same report on page 17, there is a curious spike in psychoactive medications. Look at that jump in use of antidepressants, trazodone, which is also a sedative, and antipsychotics. So while in Quebec, the, quote, inquest heard that there have been a ministerial directive not to send long-term care patients to hospital, several witnesses have testified that the elderly were often given morphine and Ativan, after which they usually died. It goes on to say, it's as if the Human Rights Charter didn't apply to long-term care residents. They let them die. And that's exactly what appears to have happened at Pinecrest, as per the directive of Michelle Snar. She's Pinecrest's medical director, who, quote, emailed families on March 21st warning them that they may have to decide on sending a loved one to the hospital or placing them on a ventilator. The latter of which, Snar said, would likely cause a patient to suffer a great deal, adding that they may not survive. That's exactly why I filed a Freedom of Information request. I want to find out exactly what communication happened at Pinecrest, with whom, and why. You can watch that full report at rebelnews.com/journalist_Tamara_Ugolini. And you can donate to the fees associated with this type of work at rebelinvestigates.com. We don't get government handouts or bailouts. We rely on the generosity of our donors to keep us afloat so that we can bring you stories just like this. And my request? Well, it's been filibustered since November of 2020. And I mean, who really knows how many months it will take to get it back? Here in Ontario, we aren't getting an inquest, which is the formal court proceeding like what is happening in Quebec. No, instead, we got a commissioner's report, and the commissioners themselves said in July 2020 that they, quote, will be doing this work very quickly. It's a massive undertaking to expedite, so much so that they asked for an extension. I'll read the letter in a minute, but first, we can see throughout the 300 plus page report published in April 30th of 2021 that there are numerous communication issues highlighted. On page 116, the commissioners note, as demonstrated by the insufficient communications guidance in the ministry's 2 health emergency plans, that's the Ontario Health Plan for an Influenza Pandemic and the Ministry Emergency Response Plan. Ontario only partly implemented recommendations in the years following SARS. Families of long-term care residents experienced severe communications difficulties in trying to obtain information about the health status of their loved ones, while long-term care homes were often left confused by frequent and uncoordinated communications and guidelines published by provincial and local public health officials. The commissioners themselves communicated this filibustering and lack of directive to Mayor Lee Fullerton on December 9th of 2020. Look for yourselves. Page 400. The commission continues to encounter significant delays in obtaining government information central to the commission's investigation. In order to meet its obligation, the commission requested all information about the measures taken to prevent, isolate, and contain the spread of COVID-19 in the province's long-term care homes before and through the second wave. In light of the ongoing pandemic and the commission's outstanding requests for information, they asked for an extension to complete the final report on December 31st, 2021. And what did we get from the Ford government? Well, his cabinet and his ministers, including the new Minister of Long-Term Care, who's Rod Phillips. Well, what did we get in response from them? Just the other day, Premier Ford pledged to invest $4.9 billion over 4 years to hire 27,000 long-term care staff. This comes after the cabinet shuffle where former Minister of Long-Term Care, Lee Fullerton, bid her farewells. She touts her own horn while entirely ignoring the system that remains broken. She offered no apology or acknowledgement around the shortfallings of her ministry, which offered questionable, if any, oversight to condemn, stop, or really do anything about the thousands of deaths that have happened in long-term care. Instead, and I'll quote Sue-Ann Levy, they rammed through Bill 218 in the fall of 2020, a piece of legislation that significantly raises the burden of proof for families that sued long-term care homes for alleged negligence during the pandemic. The families now have to prove gross negligence instead of simple negligence, characterized by advocates as a get-out-of-jail-free card for long-term care home operators. But advocates say that it's more beds and continued care that is needed, not a Band-Aid fix of inadequately trained temporary workers at a staffing level that still doesn't even begin to meet the needs of Ontario's aging population. Stay tuned as I follow this convoluted story with many skeletons in the closet. For Rebel News, I'm Tamara Ugolini. In order to continue bringing you the other side of the story and to help support real investigative journalism, please consider donating to help us continue this work at rebelinvestigates.com. We couldn't keep up with the overhead and our costs without our generous donors' support. That's rebelinvestigates.com.